going over how to
This
attract new
meeting is being
agents.
recorded.
I want to hear from you what you do, how the insurance, because
Work.
oh, Liz is gone. Because yeah, we're independent contractors. So, and Lisa and I have the same insurance guy, and I think kind of probably the same bridge policy. So
I'm on
if there's,
National General. Is that who you're on?
yeah,
Yeah.
if depending on if you don't have insurance from your spouse, then you're having to purchase it. So even when we're recruiting, there's other brokerages that say they offer insurance
But they go through like Clearwater.
But so what does that mean? Or how much does it cost that agent? Or what's the benefits, the pros and cons? Because, just talk about you and then it'll help us, I think, too. And if you have stuff you can email over, that would help. I'm going to record this so that we can put it into SharePoint and then see what Lisa thinks about maybe having you present to the brokerage, see if it'll help the agents too, because we do have agents that are business owners also. So.
Okay. Well, just to kind of get started, I was doing financial advising, and my wife, she had been doing health insurance for probably 7 or 8 years. She stopped for a little while. She was always the number one agent in the Southwest region for the company that she was representing. But a company called Philadelphia American, which is a company from, back east, they came into the Arizona market a few years ago, and my wife kind of jumped on it because there's nothing else in the state of Arizona that's remotely close in terms of the benefits, the pricing and things of that nature. What you need to know is it's on the largest market in the country, the PHCS network. So, when people ask about providers and stuff, you really need to start, we need to start teaching people how to ask, about the network, because you get, more discounts and things of that nature. But more specifically, my wife and I, we own this plan. We're brokers, so we don't just offer one type of insurance. We don't just, offer one carrier. So if we have it for ourselves, obviously, we really believe in it. Like I said, largest network in the country. You have no copays. You have no outpatient deductibles. You get 20 doctor's visits per year per person. And I know that's kind of roadkill. I haven't, signed anyone up that uses all of those. But the company, they know that if you take advantage of those perks, that later on you're not going to be the one that's in the ER, or something crazy is going to come up. So if you're healthy, you're active, you know how the stuff works. Usually you're going to be on the healthier side. And insurance companies, we all know, you're going to get charged less in premium if you're a healthy individual. So takes care of urgent cares. You get free teledoc every single day of the year if you wanted to. And on average, because we eliminate deductibles and because we're doing it based on your health, on average, we're saving people around $10,000 a year. So the plan is great. I told this story earlier on in our BNI, Mara. We signed up an individual, her and her husband, they had a group policy through her employer, and they were paying, for them, their 2 kids, like $1,300 a month, some ridiculous amount. And they are not, it's not like they're in their 50s or their 60s. They're in their late 30s, right, with 2 small children. And we were able to get them off of that group plan. Some group plans don't let you do that. Like if you're a teacher or something like that, you have to have a qualifying event. With this one, because it's a private company, they were able to get off of their insurance. And over the last month, they have sent us 3 more individuals that we've taken off of that group plan because it's half the cost, and they like, the perks are much better. And one of the cool things is, because so many people were dropping off of the insurance, we got contacted by the gal who runs their HR a few days ago. Actually, it was, hey, hon, Kayla called us on Friday. Yeah, so the HR lady, she called us on Friday, and she was like, I need to see exactly what it is that you guys are doing, because this is the 4th person, the 4th person that's dropped off of our coverage, and it's all been, to your company. So over the phone, we went over all the stuff that our policy comprised of. And, even their own HR gal decided to drop their insurance and hop on ours, and they got us a meeting with the business owner. They have 2 car lots, so it's by far, in our opinion, from what we've found, and we look for new things all the time, the best plan in the market right now in Arizona.
Can you go through like the fees and
Hmm.
what your plan is and what do you cover? So like
Yeah.
mine is, I think I pay $440 or something like that a month for 3 of us.
Mhm.
There's deductibles, like it's a bridge policy. It could be 3 years, but I chose to do 1 year just in case.
Mhm.
So that kind of like, I don't have prescription, I don't have vision and dental. So I have
Mhm.
dental through Costco.
Best way
Like
to do it, by
those,
the way.
okay, so I just to give you, but like the medical, it's, I think it's like a $5,000 deductible. There's only certain things they'll pay for. It's like all these different jump through hoops, all this stuff. But I mean, it's still, at least it's insurance, but
Yeah, like if I go for just a regular, like a pap smear woman's exam, it's at least $250 out of my pocket.
Yeah, so you
Dang.
got
No.
out of pocket expenses.
not me.
Yeah, and
I
then
don't know
like
where
she
you're
wanted
going.
to do an ultrasound, and they didn't cover that, but she gave it to me for $200 cash instead of $600. But then because I know her really well, but then I was like, so then it was like $400 out of pocket, and then when I went in to have my the girls checked, it was like another $250.
Yeah. So when it comes to doctor's visits, I mean, the average doctor's visit is between, 100 to $140. Ours pays out 160, so a fixed amount every single time. So those are, I still haven't had anyone that had to pay anything additional on just a regular visit. When it comes to, the wellness checks and stuff like that, I'm actually going to get my wife on here to answer those questions, because those are the questions she answers. So give me 2 seconds, okay?
Hey, Jen?
You want to talk about boobies with us?
Yeah.
You can talk about colonoscopies. I need one of those too. I was supposed to do that 5 years ago when my dad died, and I still haven't done it.
Yeah. So my wife's been doing this for 8 years. She knows all of those different types of questions. So if you want to go ahead and ask, do you want to go over the, just like the wellness check, stuff like that? Yeah, you can just say, she's
So
been
do
working
you-
from home. She doesn't like getting on the camera.
Oh, she's fine. Do you pay a monthly fee then? And you sign like a yearly contract?
Yeah, is it like a monthly premium?
Yeah.
Yeah.
So there's a monthly premium and there's no contract. Usually,
However,
usually what we ask folks though is to commit to at least a year, because if someone were to drop it before, then obviously we would get
Yeah,
docked.
yeah.
But there is no contract at all, so you can jump off of it whenever you want. When you qualify, they can't kick you off. So it's not like one of these short-term plans where you have to technically requalify and you
every
can
year, yeah.
every year, and you can get kicked off. For example, if you have cancer, I think Mariah told you that example
Yeah.
when I saw you. But
Once you're in, you're in.
yeah, once you're in, you're in, right? So, honey, do you want to go over like the wellness check stuff? and whatnot?
Yeah.
Sure. So wellness checks are after 60 days because they don't want people to get insurance, get their wellness check, and then cancel it. Insurance companies.
Yes.
Right. So after 60 days, you can do the mammogram and the pap smear, whatever. And so that's it. 60 days.
Yeah, and it's all covered.
It's all covered.
So do you pay, what is the monthly fee?
So so it's based on health and age. So if
Okay.
you're young and healthy, it's going to be less expensive. If you're old and you're not that healthy, it's going to be more expensive. That's just kind of how it goes. So like,
Okay.
I'm
for example,
50 and I pay $250.
yeah. And so like for example, I
Yeah.
did a quote for, I think he was only 33 or 34, you know, single guy, super healthy, and his premium came out to like 237 a month. So, you know, he's got the best plan out there, and that was including dental. He wanted dental. But yeah, I mean, that's how much it was for just for him. And
we build them the same every time.
yeah, we build them the
Because
same.
We never ever want people to be ill covered. So.
Yeah, and
Does
I
that
think the
include
biggest
pharmacy too? Does that
so
include
what we
pharmacy?
do, yeah, so what we do is we teach people, you know, about GoodRx. I know a lot of people
Mhm.
understand how it works, but what you do is you go and, you know, you get your prescription, and then you take a picture of the receipt, and then you send it in and they reimburse you. And every month, because my wife and I, we have a prescription each, every month we get checks because, you know, they pay out more than what, they pay out more than what our,
$30 for generic, 60 for name brand.
yeah, so they pay out more than what our actual prescriptions cost. So we always get checks on the back end, which is pretty cool.
Is there a preferred vendor list, like preferred doctors, preferred hospitals that you have to go to?
It's not it's a nationwide network, hon. So you can go anywhere you want to, but yeah, of course, BHCS is the provided network.
Yeah.
And it's the largest network in the country.
And we teach folks how to go and see if their doctor is in network.
Yeah.
But
Okay.
yeah, worst case scenario, if your doctor is one of the few that is not in network and you still want to continue seeing that doctor, what you do is you pay in cash, we submit a claim on the back end, and they reimburse you. That's worst case scenario. So you no longer have the stuff where it's like, yeah, sorry, you're not in network, and oh, sorry, we're not going to pay out on it. There's no more of that because it's a nationwide PPO. So, I mean, this insurance carrier, my wife and I, we went to a naturopath for a little bit during COVID, and because she got hit hard with the Delta variant. And so what ended up happening was we went to a naturopath, and because they don't accept insurance, we paid for it in cash, submitted on the back end, and we got reimbursed. Just as easy as that. Yeah. So you can go to wherever you want.
It's cash rates, but you be able to use your insurance.
Yeah.
Okay.
And because, you know, self-employed folks, they have to work to eat. They're generally the healthiest people in the world. So they really like it because whether it's for general maintenance, this is the best plan out there. If the big stuff were to happen, I still think this is the best plan out there. We have, well, my aunt is in Nebraska, and she went through, you know, treatments for breast cancer, and she hasn't had any hiccups whatsoever. Everything has gone super smooth, and she's really happy with it.
I'm glad you brought that up. So there's no coverage limitation amounts for certain conditions like cancer or diabetes or cardiac issues?
No, there is for everything. It's a fixed indemnity plan. They pay out a fixed amount. But what you got to remember is everyone after, was it January 1st?
Yep.
After January 1st, they're starting to get really tight on these hospitals and stuff like that, issuing these surprise bills and trying to kill the insurance company on the back end. Because you go in there, you just hand them an insurance card. Up until the first of this year, they would try to charge anything that they wanted.
Yeah.
And so now, you know, they have to be much more transparent about it, and they have to give you a good faith estimate. And when you go and look at, you know, like we have an app, it's kind of like the Kelly Blue Book of, yeah. So it's like a healthcare blue book essentially, where it's like, hey, if I want to go get, what did I get? It was, what was the thing I got for my heart? Or yeah. I needed to go get an EKG because whenever I go in for, tests and stuff like that, I have that white coat syndrome where for whatever reason, I just get super weird when it comes to that stuff. And so my heart rate was doing this, and they thought I was going to like have a heart attack or something. So they sent me to get an EKG, and the EKG only cost $25, right? And so I look it up just to make sure. And most doctors are going to go ahead and charge you what it actually costs. And so, yeah, you have the ability to look that up. They're tightening up regulations on these folks trying to overcharge insurance carriers. And worst case scenario, if for whatever reason, like something like that happens, which it hasn't to one of our clients yet, our company has a third party they go to that calls, and they basically negotiate the hell out of the bills down to like very, very low percentage of what they actually try to charge.
Well, let me keep on this line of questioning though. For instance, Is there anything like I used to do benefits years ago. Is there
Chiropractor.
anything like, say, a $10,000 cap on payments for cancer?
Don't need
Oh,
it.
no,
Don't
no.
need it.
Yeah, none of that. None of that.
And is
We
there,
make sure,
is there a restriction on the number of cancer occurrences that are covered? Like, sometimes people get one kind of cancer, they're treated, they get over it, and then something else pops up. Are there any limitations like that?
No.
no, I mean, I think the only thing that we could kind of put into that is there's like an annual benefit limit, which the way we set it up, we have not had anybody go over that cap. It's $1 million. And then lifetime, it's 5 million.
Yeah.
And there hasn't been one person that I've heard of with this carrier that has one of those limits. It's pretty tough to go over those limits.
So do they, I forget if you told me if they would cover the birth control, like the Mirenas and stuff, like the IUDs and.
No, so those are considered elective.
Yeah,
So,
they are.
so they
Nobody covers
don't.
those but Obamacare.
Yeah,
and they don't cover them.
Yeah, and Obamacare is the only one that says that they do, but they don't cover the IUD or anything like that. You got to pay up to a certain amount for it.
What about surgeries and births and anything?
Yeah, so surgeries, everything's covered.
Outpatient, no deductible.
Yeah, outpatient, no deductible. What I will tell you, it does not cover actual childbirth. It covers complications with it. The way to effectively cut your costs as low as you can get, believe it or not, is to pay for it in cash. And every single hospital or wherever it is that you go, they have a planned pregnancy program, prepaid pregnancy package. Too many P's in one. Yeah. Yeah, but every single place has one of those, and I mean, that's the cheapest way. Otherwise, you would be eating at a max out of pocket, your deductible and everything, and instead of paying, I don't know, just throw out a number like $5,000, you're gonna end up paying like 10 plus if you were to have just some other basic package.
So I'm wondering, is it possible to have our bridge policy and this policy? And would you be able to utilize this one initially and your bridge depending on what situation you have going on?
No.
Or do you have to choose just one to sign up with?
What does she have?
So you have a short-term plan with who?
It's like general through Aetna, national general through Aetna.
General, yeah.
So she's asking if she can have both.
Yeah, okay, so she can't have both. No.
Jen says you can't have both.
And not?
Apply every year.
Yeah, no, they know they have to they have to requalify. Yeah.
How about a supplemental plan like Shorebridge offers? Can we have those?
So which program under Shorebridge are you talking about?
Oh, they've got an accident policy where they'll pay out so much a day for a hospitalization. They have a hospitalization policy, a disability policy, things like that.
So all of that is actually covered under our plans.
Okay.
Yeah. So like we recently did a business down in Yuma that they had nothing but, cancers, or they had dentals, or you had, I don't know, accident policies. And to be honest with you, like we literally put them side to side to look at what the coverages were and to look at what the pricing was on each. And our coverage was always more, and it was always less expensive because it's packaged with other components of a health policy. Any other questions on that?
I think so. Do you have like something you can send us that kind of breaks it all down?
Yeah, can you email us or a link?
So I have a cheat sheet that goes over everything that is covered on it. And then I have a video of the actual carrier that I can send you, just kind of the mission behind why they do what they do. And, ever since Obamacare has come into existence, we've gone from like 750 insurance companies down to like 30, what is it now? 36, down to like 36 carriers. And what ended up happening was the United Healths and the, just the other big carriers, what they decided to do was hop on board and basically offer the same plans, even though they're losing money, so that they can eat up market share and basically kick everybody out. They can't compete. So now that you don't have the individual mandates, and now that you don't have, a lot of the red tape that was surrounding the Affordable Care Act, you're going to start seeing more insurance companies coming into the fold in Arizona that offer a much better deal for a lot less premium. So the only thing that, that'll keep you from getting qualified for this, is if you're pregnant, which if you're pregnant, stay on whatever plan you're on for that time. And, in the last 7 years, heart attack, stroke, cancer, or diabetes that requires insulin. Other than that, pretty much everyone gets through. We've only had in a little over 2 years, we've only had 4 people get declined coverage, which, we're a pretty fat and sick country on average, to be completely honest with you, compared to the rest of the world. So, they do accept almost everybody, which is really nice. And then once again, because we're brokers, if somebody doesn't get accepted, we have other things we can put them on. Yep. But yeah, I can get some stuff over to you.
Okay.
I'll send you my RAC card. Once again, I have a cheat sheet that kind of goes over everything. I'll send you a video. And then if there's anything on there that, like if you come up with a different question later of what you want covered, obviously just send me an email and I can give you, I can give you a call individually, or I can send you whatever update it is that you need in information.
Okay.
Yeah. Yeah. So once again, if it's just maintenance, I haven't had any issues with it. If it's something giant, I've
Dude,
had
I've
people
had crazy stuff. I had to have tonsillectomy. I have endometriosis. So you name it with endometriosis, I have had it removed. So it just depends on, and my hormones aren't covered. So that's probably something, I don't know. It just depends on that crap. But,
well, did you go to a naturopath for that?
So the hormones are through a clinical pharmacy. So I'm pretty particular if the lobbyists jack with clinical pharmacies, I get involved in that era. But so insurance won't pay for any of that. But if they change any of those hormones, then I'm not able to take anything. My body doesn't like pill forms very well. So
do you just do the drip?
No, mine's like a natural powder. So, and testosterone. So there's only a couple ways for me to take testosterone legally, because that's illegal. So, but I need it. I don't have hormones. So, when you're starting to look at, everybody's different medical issues, that's where an insurance company is like, no. Arthritis or back issues, like all that stuff starts coming into play, like physical therapy, is physical therapy covered? That's a big one. Do you guys cover that one, or is it, you pay it and then submit it, maybe that's impossible. So.
Well, what I will tell you, and that's actually a really good question here. What I will tell you is when it comes to the hormone stuff, Jen, her hormones went into flux after she got that Delta variant last year, and it kicked her ass. And I know that, like, she's super healthy, and I know that it affects people in different ways.
Yeah.
But we got reimbursed on the back end because they didn't accept insurance. When it comes to physical therapy, there are a lot of things you can get away with if you have like an actual MD housed in the same place, because we can code it a certain way and get it paid. But give me 2 seconds. Let me ask Jen. Hey, Jen. Jen. Physical therapy? Is that covered? Okay, as long as. Can you pause that real quickly? Okay. Physical therapy is covered as long as it's not from a pre-existing for the first 12 months.
Hmm.
Yeah.
That makes sense. So you're not just jumping on and using the insurance, taking advantage of it.
Yeah. Well, once again, a lot of people, they try to game the system by, they get hurt or sick and then they go, I should probably get health insurance, and then they try to use it right away for that. So companies got smart. Life insurance companies did the same thing, but the companies got smart and they said, hey, if it's pre-existing, you got to wait because you can't just jump on. We pay out so much money and then all of a sudden you cancel our policy.
Cool. Can you guys think of anything else? Liz, you're quiet, but I see your eyes.
Uncharacteristically, I know. No, I
Yeah.
was interested in the physical therapy too. Yeah, some things it sounds good. $1 million cap per year is good. Lifetime's 5. That's what you said, right?
Yeah.
Lifetime cap. That's pretty good. Sounds good. I'd be interested in seeing if you got a brochure
Yeah.
or something. Yeah.
Yeah, he's gonna email us that too. We can upload it into SharePoint, I think too. So I think that'll be good.
Mental health.
Oh yeah, that's a good one.
Yeah. Because right now, I think at least Mara and I feel like we need a therapist.
So, okay. So like if it's,
Counseling, psychiatrist, rehab, is it in there?
yeah, so that's all covered. So we just had somebody, actually they were sober for 15 years and because, they hadn't been using, recently, we were able to get them in right away to a really good spot.
Good.
So it covers all of that stuff.
That's cool.
Yeah. So if someone, once again, it's kind of it's kind of like the pre-existing thing though. Like if they've been using recently, first off, you're not going to get accepted to be 100% upfront.
Yeah.
But if you haven't for the last 7 to 10 years, and then it just so happens to come back, they'll pay for it.
You should probably explain that part to Tad. He probably needs to hear that for his clients. Just side note.
I got to say,
Divorces.
I know.
Yeah.
Divorces.
Yeah.
Pretty high in there.
Yeah.
Mhm.
Does it cover orthotics and, like if you need surgery or something and you have to have a wheelchair or a brace or something
Hearing
like that?
aids.
Yeah. Yeah.
Hearing aids. That's the first time I've gotten that question. So when it comes to everything else, like I said, as long as like, if you've had a really bad back and they've been telling you to get some sort of surgery or whatever, once again, you got to wait that 12-month period after you sign up. So, once again, it's that pre-existing thing. When it comes to hearing aids, because Jen's on a call, I'm actually going to write that one down.
Okay. Those are pretty expensive.
Yeah, those are
Okay.
expensive. Also, things like braces, like if you've developed some kind of condition and you need to have a leg brace or a back brace or something like that.
Usually what ends up happening is like they pay out so much to where, that's an easy thing to get accommodated.
Okay.
Yeah. So the braces with the dental, I believe, let's see here. Because I'm starting to get away from dental, to be 100% honest with you, because dentists, they hate dental or they hate insurance and they make our life a living hell with it. 1 second.
Mhm.
Honey?
Poor Jake. It's good for him.
Well, it is good for him. He'll know the answers to these questions the next time.
Well, it's different age groups. Like we're not there in that, we're just not there in that stage of life. So
Braces, orthodontist.
Yeah, so braces, no. Hearing aids, no.
Braces, Costco Dental. They actually help too with wisdom teeth. So just a heads up.
Oh, good. Good to know. Okay.
Mhm.
Yep.
We had to do that emergency mode with both my kids. So I think we had to be on them for 30 days and then they paid for the insurance. So
Wow. Nice.
Also vision too. Vision, go to Costco. Vision insurance and dental insurance are, they're
I don't
starting to
pay
get,
for vision insurance anymore.
no,
It's
it's
crap.
a waste of money. Yeah,
Yeah.
just pay cash for everything.
Yeah. It's cheaper to go to Walmart. Honestly, we've had a better luck with the eye doctor at Walmart than and they're cheaper than Costco.
Yep.
Truly.
Oh, they're cheaper than Costco.
Mhm.
All right.
Yeah.
Yeah, we
Walmart
just tell people to go to
Vision.
Costco.
Yeah. Their contacts are cheaper. Like everything is just better. So,
Yeah.
She's right.
Yeah.
but
Yeah.
that's just me. So,
So
okay.
like I said, we teach people how to use the the fair pricing tool. We show folks how to navigate the health system, because it's not, it's broken, and no insurance is perfect. You still have
Yeah.
medical offices, or you still have hospitals that are trying to bill the heck out of you, which is why
Oh, yeah.
third party to help with that. So once again, nothing is perfect, but
Mhm.
how long my wife's been in this industry, this is by far the best one she's found.
Mhm.
Cool.
So I'll get something put together. I'll just send you that cheat sheet I
Okay.
told you about, and then a video explaining why we do what we do. And then
Okay.
if you have any further questions, Mara, just email me or give me a call.
Okay. Thanks, Jake.
Okay. Of course. And I'm going to
Thanks,
log this as
ladies. Mhm.
but
Thank
if
you.
you guys, and new puppy, sorry. And if you guys have any
Yeah.
other questions, just, you can email me. You have my information, and I'll get back to you too. Okay.
Okay.
That's good. Okay.
Perfect.
Thank
All right.
you.
And thank you.
All right. Bye.
Bye.